Dr. Vikki Petersen here. I wanted to tell you about a case study from here at the clinic that I think you might find interesting. A lot of times I'm talking about the science and the research and things like that, but sometimes I think it's nice to hear a case study, a real live person. So this young lady is 30 years old, and she came to us with many different problems. She was fatigued, she suffered from insomnia, so she wasn't sleeping, she had migraines, she had IBS, she was pretty miserable, but one of the major things she was suffering from was arthritis. She was on medication for her arthritis. She'd actually had surgery of her knee because of the arthritis, and she was told that she was going to need more surgeries for her knee. So there were a lot of things bothering her, but this was definitely concerning, being only 30 and suffering from such severe arthritis that she was requiring surgery and apparently going to need more. When we saw her, as I mentioned, there was a long laundry list of complaints. We always start with the diet. We always start with the digestive tract and kind of work outwards from there. And funnily enough, we didn't need to work out too much farther from the digestive tract. So here's her story. We found her sensitive to gluten as well as dairy products. She was very good about following her diet and started feeling better digestively quite quickly. Her migraines abated. With that, her energy improved, and she was sleeping better. So all of those things were actually turning around quite nicely. But still, a couple of months into care, she still had a lot of pain with her knee, which makes sense. Arthritis is, number one, an autoimmune disease. The body's immune system is attacking itself. We know that gluten is very associated with autoimmune disease. It only makes sense that if you were to catch it soon enough, which in this case we did, and she's young enough, only being 30, that if you were going to turn off this whole machine of gluten getting through the gut, out into the bloodstream, through molecular mimicry, the gluten seeming similar to a person's joints, so the immune system doesn't just attack the gluten, it attacks the joints as well. You get inflammation, you get degradation, all of those things happening. If that whole machine is going to reverse itself, it only makes sense that's going to take several months in order to do so. So when we saw her about 3-4 months into care, pretty much everything was looking very good except the knee. She came in today, so that's what prompted this video to you. So she came in today very, very excited because she had just had an MRI of her knee, was feeling a lot better, but her doctor, of course, her rheumatologist wanted to see what it looked like. So she had the MRI, and what they found was a huge diminishment of her arthritis. Her doctor was absolutely blown away and astounded by the reversal, and really all he could say was, obviously, inflammation has very, very much diminished in your body, and whatever you're doing, you should continue doing. I wish he wanted to know a little bit more in detail what she was doing. That's one of my little gripes, if you will, that when doctors have patients who do these dramatic reversals, which we delight in seeing very regularly here, I'm always surprised that the doctor doesn't want to know more in detail exactly what the person did to get those great results. But we'll leave that for another day. The good news is that this 30-year-old is feeling great now. Her arthritis is in reversal. She knows what to do, and all is good. So I wanted to share that with you. We see that with many autoimmune diseases. The thing about autoimmune, as a last comment, is it's almost like a machine, and once it really gets going, it's hard to stop and reverse that machine. But if you're young enough and you catch it soon enough, then miracles can happen. So I hope you found this informative, and until next time, I wish you very good health.